Assalamu alaikum. I am Masud Rahman. I am a doctor working in New York for the last 24 years. I am an anesthesiologist and pain specialist. I have been with my whole family and we have suffered, all of us, from COVID-19 infection. By the rahmah of Allah, we have all recovered. Some of the doctors and friends in New York and other places have been requesting me to tell about my entire experience so that some others can get complete or partial guidelines about how to cope with COVID-19 infection. I thought about the matter and decided to do that because my life is a bonus given by Allah. I'll do anything that may help my fellow human beings, especially for this pandemic coronavirus. The disease is new. We are learning every day new information about this disease. So there are multiple types of treatments and many are working. However, whatever has worked for me and my family, I'm going to narrate that. I hope some of you may get some guidelines from here. As usual, I was seeing patients as a doctor in first week of March. I was learning about corona and was doing a lot of television programs to alert people of my community and share the evolving knowledge. By the beginning of the second week of March, I started to feel symptoms like coughs, mild high temperature, malaise, body ache, etc. Before going any further, let me introduce my family, as all got COVID-19 and all developed the symptoms. My family are my wife, my daughters 32, my sons, twin sons 26. We observed different grades of corona symptoms. All of my family members got after me. My sons became all right in about 7 to 10 days. They had temperature, sore throat, cough, shortness of breath, and lost their sense of taste and smell. My daughter had a history of mild asthma. Symptoms lasted longer, and with her coughs and respiratory problems lasted a little longer. My wife suffered 10 to 12 days too, but all got better. So you have seen the mild form of coronavirus in some of them. But I was not so fortunate. I thought I got better in 6 to 8 days. When I was feeling much better, I thought things are over. Before that, I took azithromycin 500 milligram on day 1 and then 250 milligram for 4 days. And I also took hydroxychloroquine 800 milligram on day 1 and 200 milligram 2 times daily for 5 days. I then felt that the symptoms became nice and I got better. But on the 10th day, I started to get very sick. From now, all my treatments were done by my friend, Dr. Masud Rahman, an attending physician of Queen's Hospital, and I'm very grateful to him. He is one of the best in New York. He was the best teacher of Mount Sinai School of Medicine. He decided on all the COVID-19 treatments in Queen Hospital Center and treated me. However, I had temperatures fluctuating from 99.5 to 103. This is after 7 to 8 days of the symptoms started. I was taking Tylenol too when my temperature was 102 or more. I had sore throat and started to have coughs. My body was unimaginably painful. Malaise or body ache. Remember, the body ache is more than you have ever experienced before for any reason. Cough was so much that I had to sit on my bed for the whole night, nights after nights. And I was coughing and having chest pain, abdominal pain, whole night. My abdomen was so painful, along with my vocal cords, that I couldn't make any sound. I felt breathing difficulty to the extent that sometimes I thought that this would be my last day. My wife and children sat beside me, my bed, all the time. No wonder they all got sick. So about 12th day, important, that my treatment was like this. Azithromycin 250 milligram each day till now. That was started again. Hydroxychloroquine 200 milligram 2 times daily started and continued for about 8 to 10 days up until the temperature came down. And I did vapor therapy. Remember this thing, very important. Vapor therapy, hot steam plus eucalyptus oil 4 to 6 times a day for 8 minutes each time. It doesn't have to be 8 minutes. Whatever clears your chest and reduces your cough. Then I had nebulizer just after steam therapy with albuterol sulfate for 20 minutes each time for 4 to 6 times a day. I was in a prone position for 2 times a day, each time about an hour. All those except hydroxychloroquine are continued for more than 20 days. After these treatments, in 3 days or 4 days after the treatment started, which is about 10-12 days or 3-4 days, 14-15 days after, I had no fever, no body ache. My taste and appetite was good. I started to eat normally and I walked a mile each day. The cough was bothering me at night, so I had one more medication added. That was prednisone. 40 milligram for 3 days, 30 milligram for next 3 days, 20 milligram for next 4 days, 10 milligram for next 4 days. And about the 25th or 26th day, the cough was getting better, but I still couldn't sleep normally while having 30 milligram prednisone. I started again by Dr. Habib 2 new meds, which were Spriva and Advair. From the 23rd day till now, I am walking 1 mile a day. Now it became normal since I have little to no coughs at home. After 34 days, there were almost no coughs, no temperature, no breathing problems. I walked a mile each day for more than 8-9 days. I'm still on azithromycin. Now the prednisone is 10 milligram. I'm taking Spiriva once a day, Advair twice a day. My daughter needed steam therapy more than others and needed symptomatic treatment, also azithromycin and hydroxychloroquine. My sons, one did not suffer more than 7 days, and the other and my wife all suffered for 10 to 15 days with all symptoms except respiratory problems. So in the same house, COVID-19 had different grade, mild, moderate, severe. Each has to be dealt separately. Do you know how many odds against me were there in this time of COVID-19? Number 1, stroke history. Number 2, hypertension. Number 3, diabetes. Number 4, history of aspiration pneumonia. Number 5, age above 60. This is my experience. It was a great fight, but Allah has healed me. Now let's review what are the things you need to combat this dangerous disease. I'll talk on different things now, and I'll be using both languages now. Medicines, instruments and non-pharmacological medicines. Now medicines, what you need is this. Tylenol. That's Tylenol. You'll need azithromycin. You'll need hydroxychloroquine. You'll need prednisone. You'll need Spiriva. You'll need Advair. If you open it, it's like this, Advair. Not at the same time. They come into play at different times as required. Now instruments. First is you must have a thermometer. It could be anything. You could put it under your tongue. You could have one like that with the light there, hold it here, the temperature comes here, and you can see that. That's needed. The most important thing, most important instrument is pulse oximeter. See this? Look at my finger. This is a pulse oximeter. The finger, you just have to place it like that. Put it in. The pulse oximeter will give you the number. The number here is, you see, 96 and 98% and 112. Maybe the heart rate is a little high because I'm talking for some long time. So pulse oximeter is a must. You can get it from CVS online or CVS shop. After the pulse oximeter, you'll need the steam therapy. Steam therapy, I'll show you exactly what it is with eucalyptus oil, but before that let me show you what is a nebulizer. This is very, very helpful. A nebulizer is a machine like that. You see the machine base is connected to a power line and there is a switch to make it on or off. And there is a breathing tube. The tube goes and ends up in a chamber like that. Just a chamber like that. This chamber, you open it, put the medication which is here, which is albuterol sulfate. Squeeze it in, put this on, switch it on, hold it in your mouth, in by mouth, out by nose, and it takes 20 minutes. Every day, 4 to 6 times that I had to do. And after that, the humidifier, that helps. It's not a must, but it helps. It gives the humid, the room becomes very nice for breathing, easy. So that's one. And you must have a small garbage can. Why I'm telling you now. Now let me show you how the steam therapy, which is practiced in every single country they have done, and they have got very good result. This is like that. You see there is a pot like that, water inside, very much hot, make it hot, steam coming. Take the eucalyptus oil. Eucalyptus oil is found in any kind of vitamin shop. Drop about 3 or 4 drops in the water. The fume is coming. To hold it, look at me, what I do. You have a towel like that, cover your head and the pot, and then breathe in by nose, breathe out by mouth. It will be very hot, but you have to continue that for generally for about 8 minutes. For me, 8 minutes was required to clear up all the thick secretions, mucus secretions in my bronchial tree, in my lungs. So while you do that, naturally you cough a lot because those are all coming out. You have that garbage to cough it out. Coughing is normal at that time. So this is one of the most life-saving thing, at least for me and my family. And there are other few normal, non-pharmacological, non-traditional medicines like Jam water. And this is real Jam water. It's a matter of faith. You believe it, you have enough strength in your mind, your immunity helps. Plus, this is the best water tested chemically in the world. So Jam water is the water that you drink whenever is necessary. Then you take some coconut water. You get dehydrated many times. You have some honey, black seeds, ginger, green tea as needed. Make hot green tea with ginger and honey and then drink it. Remember, take only warm water, and you need very strong will, and above all you need the favor, mercy of Allah Almighty. Finally, every day the understanding about the disease is changing. Pathophysiology is being understood more and more. We are still in trial and error in treatment. But this has helped my family, and some other doctor friends got infected. I did it because I thought my experience at different levels that has happened in my house can help some of you, if not all, anybody gets any help from this and gets better with COVID combat, that will be great for me. I wish you best of luck. Be safe. Thank you very much. Assalamu alaikum.